Come on, have you ever asked yourself this question? How many eggs are left in my ovary? How do I know how many eggs are left in my ovary? Can I produce more eggs when I notice that the eggs in my ovaries are down? Is there anything I can do? Is there any medication I can take to produce more eggs? What are the facts about this egg production? What are the facts about the eggs left in my ovaries that I need to know as a lady? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today we are going to be talking about how to know the amount of eggs left in the ovaries, the type of test that you need to carry out to know the amount of eggs left in the ovaries, and also facts about this egg production. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be talking about the amount of egg left in a woman's ovaries, in her 30s, in her 40s, in her 20s, the amount of egg left in the woman's ovary. As a woman or as a lady, it is important you know the amount of eggs left in your ovary, especially when you are trying to conceive. We all know that as a lady, you produce egg. You release egg every month from your ovaries. While the men, they are the ones that produce sperm. And for fertilization to take place, the egg has to meet with the egg. The egg has to meet with the sperm for fertilization to take place, for pregnancy to occur, and for a baby to be formed. So if a woman's egg is plenty, is in excess, definitely she has higher chance of getting pregnant easily. But before I go into details about the test, that determines the amount of egg left in a woman's ovaries, I want you to know that when a woman is above 35, when a woman's age increases, her fertility rate decreases. The quality of egg she releases decreases. The amount of egg in her ovarian reserve decreases. That is why it is advisable for ladies that wants to get pregnant to try and do that in the early age. It's better in the 20s. It's usually peak at 25. So ladies produce good quality eggs at the age of 25. They produce good quality eggs in their 20s. But as age increases, the quality of egg they produce decreases, and also the amount of egg remaining also decreases. And also, I want you to take some key facts about this egg that is being produced. So I actually dropped the key facts about the eggs that is being produced in a woman, in a lady, in a girl. So I'm going to be looking directly on my phone because I saved it here. So the first I want you to know about this egg is that as a fetus, the ovaries will hold 6 and 7 million eggs. That is when the baby is still in the womb. When the baby is still in the tummy, the baby has 6 to 7 million eggs. 6 to 7 million eggs. At birth, that's when they give birth to the child. The child will have around 1 million eggs. When the baby is in the womb, the baby has 6 to 7 million eggs in the when the baby is still in the womb. The girl child is not out yet. So when the girl child comes out, the girl child has 1 million eggs present. Then at puberty, the ovaries hold around 300,000 eggs. So when the child starts having her breast, her bum, everything, at puberty, a girl child has 300,000 eggs. At 37 now, eggs decreased further to around 25,000, and there is 20% chances of getting pregnant. At 37, egg number decreased rapidly, and at 40, there's less than 5% chance of getting pregnant per cycle. At 40, there's less than 5% chance of getting pregnant per cycle. At menopause, only 1,000 eggs remain, and these are not fertile. So when a woman gets to menopause, the woman still has 1,000 eggs remaining, but these are no longer what? Fertile. So if you are trying to conceive, it's advisable you speak with the doctor. So these are the key facts I want to share with you about this egg release. Then back to the video proper. What is the test that is to be done? What test should I carry out to know the amount of eggs present in my ovaries? So the test is known as anti-mullerian hormone test. Anti-mullerian hormone test. I hope I'm pronouncing it properly. I'm not in an English class, but I'm dropping the spellings down below. It's an anti-mullerian hormone test. What this test does, it gives you an idea of the amount of eggs present. It can be done any time of your cycle. You don't have to wait for your menses. You don't have to wait for your ovulation to do this test. It can be done any time of your cycle. So this test is actually done with blood samples. Blood sample is taken from your vein, and it takes few minutes for you to get the result. So normally they classify it into different levels. If you they classify it into different levels. The first is undetected level. Then the second is the reduced level. Then the third is the normal level, and the fourth is the excess Mullerian test level. So if you are having excess and you are having normal, it simply means that you have a higher chance of getting pregnant. And also, when an IVF is done, the ovaries respond very well when an IVF is done. So that is for the excess and for the normal Mullerian test, when you get the excess or normal. But when you are getting reduced, there could be a lower chances of you getting pregnant as a woman trying to conceive. And this reduced level is it occurs in women above 35 years. The reduced level occurs in women above 35 years. Then the undetected are found in women who are already in their menopause level, or they are having failures with their ovaries. So when you do this test, the doctor might tell you, oh, your anti-mullerian test hormone is in excess, is normal, is reduced, is undetectable. So when you know that, that gives you a clue of the amount of eggs left in your ovaries or in your body as a woman. Then some school of thought will just give you straight, they'll give you the value straight. So if the value they gave is measured in nanogram per milliliter, so if the value of the anti-mullerian test that was done is between 1.0 to 3.0 nanogram per milliliter, that is a high level. But if it is less than, if it's less than 1.0, is a moderate, like is a low level. Then if it is less than 0.4, it is a very low level. If it is between 1.0 and 3.0, it's a high level. If it's less than 1.0, it is a low level. If it is less than 0.4 nanogram per milliliter, it is a very low level. So it all depends on the facility you go and what criteria they want to use to tell you your anti-mullerian test. So they might tell you the figures, or they might tell you, oh, it is undetectable, it is reduced, it is in excess, or it is in normal. So that is that for the test. So if you want to know the amount of eggs left in your ovaries, you have to do the anti-mullerian hormone test. That is the test to be done. So I've heard ladies asking this question, Nurse Mary, is there anything I can take to boost my hormone level? Is there anything I can take to boost the egg in my ovaries? I want to increase the egg production in my ovaries. The fact is, there's no drug, there's no lifestyle that can help you boost your egg. Your eggs, the amount of eggs you get, they were already given to you at childbirth. So as time goes on, you keep releasing these eggs. These eggs keep reabsorbing into the body, and it's reduced on its own. So there is no medication, no lifestyle that will help you to increase your egg production after birth. I've not seen a research that I've said that. I've not seen any drugs yet. But definitely, if in the future I see something like that, I will let you know. So this is all I have to share with you in regards on knowing the amount of eggs left in your ovaries. I hope this video is beneficial. I hope you got value from this video. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.